Joining me today is Chirag Khutia. Mr. Chirag is India's top career coach for students planning a career in medicine. He has successfully guided over 50,000 students to choose their right career path, and he has 15 plus years of experience in international medical education domain, working with companies like Kaplan, Becker Healthcare, and more. He has extensively traveled to the US, and his students have successfully matched into residency and fellowship programs in the US. He has delivered over 350 sessions on US MLE in medical colleges in India. Chirag believes that pursue excellence and success will follow. Chirag, it's a pleasure to have you with us today.
Thank you, Devesh. Absolute honor to be part of your, podcast.
Superb. So we'll straight away jump into the questions. My first question to you is, what is the key difference between pursuing an undergraduate medical degree in India versus abroad?
All right. So when it comes to medicine, I usually recommend, parents and the students, is to not just think about undergraduation, but career as a whole, especially when it comes to, today's doctor. He needs to be, what we call in our, medical technical language is a T-shaped doctor, where the horizontal T means a doctor knowing his own specialization, also supporting the specializations of physicians who are not present at that moment. For example, let's say a neurologist is not a common specialty and is not available across India. So a lot of 2 tier and 3 tier cities, we have a psychiatrist playing a role of a neurologist, until the patient can be referred to a primary or a tertiary care center. At the same time, when I say the horizontal of T is the deep expertise, thanks to artificial intelligence and the biomedical innovations, there are deep specializations involved. No longer it is just about general surgery. It leads to orthopedics, within orthopedics, particular, let's say, spine. So there are specific fellowships opportunities now available. So my suggestion to every parent always has been, when you plan your career in medicine, think about undergraduation, post graduation, and further specialization. Just to add an example, last year GTP Hospital in Delhi announced 12 positions for junior doctor, which is like just MBBS pass out doctors, and there were more than 500 applicants. What does that mean? That MBBS or undergrad degree is not no longer just the only thing. You have to definitely look for specialization. So keeping all of these things in mind, you have to kind of plan. Now, coming back to your original question, undergrad in India, what are the advantages versus abroad? So typically, the undergrad program in India has advantages in terms of the access to the number of patients which the students get, and to work on hands-on, in terms of the direct exposure to patient care. Vis-a-vis, if you are talking about any country abroad, for the undergrad, especially the initial 3 to 4 years, they are only given access to mannequins or 3D anatomy models. So that's like a key difference and reason for confidence of Indian doctors and demand of Indian doctors globally. Now, why do parents or the students aspire to go abroad? In case of medicine, there are two reasons. One obviously is the marks, because it is going to be very competitive in India. So there are countries abroad which might not assess you only on NEET, but your overall profile. At the same time, when it comes to the second reason is the budget. So in budget, we again have two category of countries. One are the low cost countries where obviously the cost of education is cheaper, but so is the quality of education. And then obviously there are Commonwealth countries where the cost of education is equal to any private med school in India. But definitely the parents send the students, keeping in mind the high quality of education, access to research facilities, and a global exposure, which can then help them in future think about becoming a global physician. So I would say, each has a pros and a cons, and we have to assess based on, I would say the budget, based on the long-term provision of what post-graduation, reason to settle abroad, and also, keeping in mind the recent NMC study abroad, foreign medical graduate regulations, which were released in November 2021. So these are few things, if we keep in mind, it helps us to take a informed decision.
Okay, fantastic. That is very helpful. Thanks for highlighting that, Chirag. Now, that brings me to my next question, which is what are some practical tips on how students and parents can decide whether to pursue an MBBS in India or explore options in countries, as you were mentioning, maybe the Caribbean or Russia or the UK?
Perfect. So, again, there, the choice is first to understand the NMC FMGL 2021 guidelines. So if your long-term plan remains that you also would want to consider coming back and working in India, then you need to follow the FMGL 2021 guidelines, which states that the length of the education has to be minimum 54 months, which is equal to the education in India. There should be an additional 1 year of an internship, which happens here in India within the same campuses. Now, there are many institutes in Georgia, Philippines, where they run more of a coaching providers, and hence all send the students to a common hospital for rotations, which technically is not allowed by the NMC. In India, if we see, every med school has an hospital attached to it. Third, criteria which is important is the reciprocal registration or a license to practice. Meaning, the Indian government wants that if you are allowed after completion of degree to practice in their country, wherever you are going to study, the host country, you are also allowed to give the FMG examinations and work in India. If the country where you pursue education does not consider your degree as a registrable degree, that becomes a challenge. So here we have to keep in mind the final requirement, which is the language of instruction should be in English. So many of these low-cost countries teach either complete training in Chinese or Russian or Kazakh language, or they are dual, meaning basic medical science happens in English, clinical years happen in Russian, Ukrainian, Georgian language. So you have to choose education and training in English language, because one thing you have to keep in mind: many countries, like say China, Russia, Georgia, have the final examination, which gives you a license to practice in their country in their local language. So yes, it is advised, if you are considering these countries from day one of med school, also learn the local language, because that's how the best you could, kind of interact with the patients and have the best exposure of the clinical years as well. So these are few things we have to keep in mind in terms of the FMGL regulation. Now, why, as I said earlier, why would people consider the low cost country? Obviously, with the regards to budget and the language country. But when it comes to English speaking countries, let's say UK, Australia, many of them have programs which are obviously at par, or I would say at times more expensive than the Indian private med schools. So there we have to do a cost benefit analysis. If you're getting into a top tier UK university, that's great. The UCAS application allows only 4 med school to be entered in terms of application. So if you're getting into top tier grade, the percentage of acceptance roughly has been less than 5% so far. But otherwise, my suggestion has been that, let's say you're spending roughly around 4 CR in an undergrad UK education. In the similar kind of a budget, you could do an undergrad plus a postgrad from a decent private med school in India. Also, the education system, both in UK and Australia, there are some programs which you only pursue after a bachelor's degree. Like what happens in US and Canada. Initially, you do a bachelor's degree in sciences, then go for an additional exam like an MCAT in US, Canada, or a GAMSAT in, or a UCAT, for postgrad, sorry, the graduate degree programs in, UK and Australia. So then those degrees will have added additional 3 to 4 years before you start like an actual program. This awareness is very important. A lot of time, when students look for or seek for an admission and reach out to possible admission providers. Okay, admissions to US, they would say, okay, prepare your SAT and ACT, but that's just an admission into an undergrad program, or for that matter, many commit admissions into Philippines. So again, there the undergrad program is just a BS, which is 1.5 years. Later, you will still have to write an exam like an NMAT, and only if you've qualified by NMAT, you get into an MD program. And so is in United States. So last year, roughly around 70,000 students wrote the MCAT examination, and only 2% of international students got into medical school. So these are certain data you need to keep in mind and then kind of take a decision, because obviously that increases the length of program. Almost an 8-year program if you're aspiring for a US and Canada, 4 years of an undergrad and 4 years of, then the grad degree of MD medicine, which is equivalent to MBBS in India. So these are few points we have to keep in mind. Budget, the length of program, NMC accreditation, and then take a call. Because if your aim is again, so then a lot of parents, have, I would say, the family and friends, and their ultimate aim is to only settle in United States. In that case, to save that 8-year pathway, probably reduce it by about 2 years and reduce the budget by, let's say, 50%. That is where the Caribbean med schools come into picture. So Caribbean med schools typically have a 5.5, 6-year program where they teach USMLE style, American style education parallel to their medical school, where the initial basic medical science and BS happens on at the island, and the final 2 years of clinical rotations are conducted in hospitals across United States. So indirectly, that becomes like a guaranteed placement into an American residency program. And obviously, it's a great pathway for very serious students. Now, the only challenge is within the Caribbean islands, there are more than 40 plus med schools. Not every med schools are good. I could say handful, 4, 5, top 4, 5, we would strongly recommend. There are accreditation issues, campus vibes and things, because ultimately those are islands, so it's more of a tourist destination. At majority of places the challenge has been that people party more and work less, and so you have to be very careful which island you go for. There are accreditation called as ACCM and CAMHP. You have to check their website, because a lot of these accreditations are then taken away. Maybe at times universities have faculties only for the first 2 years, and later on they don't. So obviously there are a lot of such infrastructural challenges as well. So Caribbean is a great option for parents who are looking for a one-way route to United States. Why I say one-way? Because again, because of the model of education in the NMC FMGL guidelines, it is mentioned whichever college where you study, the same hospital you have to do the rotations. In the Caribbean model, you move to different hospitals in the US. Plus, the length of program does not match the Indian system. So hence, majority of programs in Caribbean are not kind of recognized back here in India. But it's a great option for somebody who is completely into a long-term career of a residency, fellowship, and finally settle in the American healthcare system.
Now you spoke so much about so many different countries. You spoke about the different exams that the students need to take. I'm sure the application process would also be quite complicated in most of these places. But what are some of the common mistakes that the students make during the admission process? And if you can actually provide them some practical tips to avoid these mistakes.
Yeah. So first thing is obviously is I would say maintaining a correct timeline. Most important, because what we've realized is that the assumption of a lot of parents is that the way Indian system works, that's how the global system works, but it is not. And at times in India, the NEET examinations or the results of NEET kind of get delayed. So the institutions abroad do not actually wait. And let's say a lot of times the people who are from IB board or IGCSE, if their results are not out, at times that's also a prerequisite when it comes to a lot of Indian med school admissions. So we have to keep all of those timelines handy. In India, the most important thing you need to understand now, the entire admission process is completely centralized under the Medical Council, MCC. And then obviously state have their own stray vacancy rounds. So understanding the timelines of the central MCC counseling and the state-wise counseling, visiting the state medical boards, these are few things, you have to keep well in advance in terms of the information, the deadlines, the specific states which you are trying to apply, considering there is a national 15% quota of admissions into any states for students across India. But within your states, there are different percentage of people who can be admitted, what we call as a domicile quota. So all of those things, in case of abroad, the low cost countries also have an apostille document requirement, which gets from the local embassies. Majority of them are in Delhi. So those documentations also take a lot of time. And trust me, this might look trivial, but we found, especially when it comes to students in grade 12, aspiration is there across India, and we've seen students coming from 2 tier, 3 tier cities. And many a time, while parents are planning all of these things, they miss out a very simple document, that you require a passport to actually go abroad, So this is like a very basic thing, but then it does happen a lot of times. So obviously these are things which we have to kind of keep in mind. Then obviously, when it comes to the, let's say, admission process, one very important thing is the NEET UG requirement. So, while there are expert, I would say, mentors or career coaches who are helping with the admission process, there are also, kind of agency bound or, so-called admission contractors which are there, who would say there is no requirement of a NEET UG, or there is no requirement of registration with the NMC, the Medical Council of India. So one of the very important thing the parents need to be aware that when you actually go to study MBBS abroad, before flying, you need to get registered with the Medical Council of India, for and secure something called as an eligibility certificate. Now that's an important document because once you are completing your undergrad program outside India, and when you come back and you wish to write a foreign med grad examination or the national exit text, if and when the government proposes, you will require that eligibility certificate. So last to last year, the National Medical Council released the list of 935 students who actually did not, submit the eligibility certificate, and then they had gone to study MBBS outside India. Now, which means then you no longer will be ever allowed to work back in India. So it's like again a one-way route. So these are few things which definitely I would strongly recommend. Always believe on the official websites. So one thing when it comes to studying abroad again, or for that matter, India, there is a only directory which is reliable called as World Directory of Medical School, WDOMS. On that directory, .org. So WDOMS.org. So on that directory, you find the year of med school, the language of instruction, the official website to the university. Many a times you just type a med school in Georgia and there'll be 20 websites coming for the same university. 19 of them are by some agents. There's only one genuine for the university. So you only get the correct information from the actual university website. And whether or not they are accredited in US and Canada for a global post-graduation later on. These are few things we need to kind of identify while also selecting a medical school and also then getting the genuine requirement. Last but not the least, obviously, these days we are in the time of AI. So a lot of time the parents get offer letter, and especially when it comes from non-English speaking country. So these offer letters are in Russian, Georgian, Ukrainian language, and parents do not understand. It is always better to get translated and identify whether it's a genuine document, A, B, if the college is correct and if the course is correct. There are instances where in Kazakhstan, people have been recommended a 5-year program, which was then not recognized for any USMLE courses in the United States. And then after few years, when the student realized it, the students were asked to re-enroll for another 2 years and then complete their Doctor of Medicine degree, which is equivalent and globally recognized. Now, those 2 years were technically internship where students get the stipend, but these universities started charging tuition fees, which obviously affected the budgets of the parents. So these are small little things and a lot of nitty gritty. So always believe on genuine information. A lot of time in the advertisement you would see a so and so university is NMC approved or WHO approved. NMC on their website have clearly mentioned they do not endorse or approve any university. And now WHO globally has been dissolved. Every particular body have been merged to one, which is World Directory of Medical Schools. So only refer to authentic. All the Indian med schools are also available on that website. So only believe on that directory, and then checking on the school websites. I would suggest going through all the process. And one last thing when it comes to especially the Indian private med schools, not all are good. Just because they have a fancy infrastructure does not mean the academics, does not mean the lab work is that great. So it is always advisable before you kind of take a decision to visit at least 3 to 4 campuses, understand it, and then put their names in the MCC counseling round. Because at times what we've realized that people just put random names considering the geographical proximity to their place, and then if they want to change it, it is not possible. You cannot change your options. So it's always better to research. In fact, use the time after your NEET exam. I mean, many a time students know tentatively what kind of scores they are going to have. So try to assess the last year's data, and between your NEET exam and NEET result, all of these research needs to be done so that you save time. Once the result is out, you can kind of go ahead and take your next steps in terms of the admission process.
Fantastic. That's a lot of points to take care of when you are applying to colleges. Very elaborate. Thanks, Chirag, for sharing that. Let's talk a little bit about the NEET exam. How we understand that it's important to take that, and it's mandatory to take that when you are applying for Indian medical schools. But is it also helpful when you're applying to study medicine abroad? And does that come into picture for medical colleges abroad?
Correct. So, this is a very valid and a very important question which you've taken. So, again, the point is that what is your long-term plan? The NEET UG examinations are mandated for admissions in India and also for admissions abroad by the National Medical Commission. If you ever wish to come back to India and write the foreign medical grad examination, get an equivalency and a license to practice in India. So if the long-term plan is that you want to come back and work in India, then yes, NEET UG is mandatory. However, if you ask about a requirement of a particular school outside India, obviously not. None of the Caribbean med schools require an MCAT or a NEET UG. And when it comes to UK, obviously they have the UCAT examination. Australia has UCAT, or GAMSET is an examination. So every particular country would have their own set of exams, or they would go and assess you based on your grade 12, mark sheets. So accordingly, the admissions happen. But yes, it is mandated in India that you should have a minimum 50 percentage in PCB. That's when you're eligible for NEET UG. And NEET UG has a qualifying marks. So while let's say the score is about from 0 to 720, that's the band. Usually, average qualification for open category candidates has been roughly around 134 to 137, between that score. So a lot of time, in spite of a score below qualifications, parents aspire and students aspire to study MBBS. Well, obviously they can study and they can actually go for a program. But if they wish to come back and work in India, with that score, you are not allowed to even pursue a medical program in India. So yes, minimum marks is a qualifying marks, which is around 134 every year, obviously based on the percentile system. They release what's the qualifying mark. So you need to make sure that you are qualified for it and not just an attempt.
So what I take back from it is most all countries will have their own qualifying exams. But if you want to come back to India to practice medicine after studying medicine abroad, if you want to practice in India, then you'll have to take the NEET UG exam, right? or probably sometimes the NEET PG exam if you're planning to do further studies in India?
Yeah. So when it comes to further studies, yes, need PG, but that's only after FMGE examination. So one very important timeline you need to understand that, let's say a student after grade 12, decides to, uh, pursue a medicine in India. He does a 5.5 year program. At this point of time, there is no exit examination, so immediately can write the NEET PG, and or decide to set up a shop and practice in India. Either ways, it is possible. But any student going to, let's say, Russia or Georgia, usually their programs are 5.5, 6 year program. So those are 6 years. Some programs have the internship part of the program, no issues. If not, an additional and internship here in the country as a mandated requirement for the NMC FMGL guidelines. Typically, I would say, if all inclusive, maybe 6 to 7 years. After that, you are talking about attempts of FMG examination. Usually, you take about 6 months to prepare for that exam. These exams happen every year in June or December. So typically, people have a pass rate of about only 20% for the last 10 years. So which means out of every 100 student attempting, 20 pass in
Yeah.
one cycle. So that would be another year. So I would say total 7 years. After, after you pass the FMGL examination, the another mandatory requirement of NMC FMGL guidelines is that you have to pursue a 1 year of internship in India. So that will add an additional 1 year into
Yeah.
your education, after which you get a license to practice in India. So technically, students who go to Russia or all of these low-cost countries will have to, at least spend 8 years after grade 12, after which they get a license to practice in India.
We are almost coming towards the end of the session now. So my final question to you is actually, what advice would you give to the students who are passionate about studying medicine and becoming doctors, but they're unsure about the path to choose?
Yeah, so one and very important thing is this decision is a collective decision of the family. So it is very important to all the stakeholders to be part of the discussion. First thing is for the parent side to understand that this is a long career, and maybe a lot of the social milestones will take a back seat, because there's an undergrad program, there's a postgrad, there are license examinations. So it is a 10-year journey. So the parents need to understand, whether it is in India or abroad, you are committing, your child is committing a minimum 10 years to this career. Obviously, post that, the career graph is completely different to other professionals, but that 10-year commitment is mandatory. So to the students, I say, since this is a 10-year commitment, you need to, have to assess one very important thing, is that whether you are doing it for yourself or for your parents or just because your peers are doing. Because this is a career which requires 100% of self motivation. It is not an easy career. I have seen students, I do a lot of these sessions in med schools in India. So career planning sessions, so I talk about medical school survival. So it is kind of challenging. So it is very important that that self motivation is there. And secondly, I strongly advise students, before joining the med school, or maybe before preparing for NEET, probably until your grade 9, grade 10, there were hobbies which you were actively pursuing, something you really enjoy, rejoice. But suddenly, when it comes to the NEET exam, the board exam, then finally during the med school, people forget that. And these are things which I strongly advise for you to continue, because medical as a profession is very much stressful, and so is the medical education. So definitely pursue a productive hobby which can keep a check on your mental health and a physical health, and that will really go, help you in a long run. Because trust me, it is very competitive, and at the same time it is stressful. And I've seen successful students are not necessarily academically very bright or toppers, but those are the ones who are very consistent and probably take one day at a time, rather than worrying about what's going to happen in next 2, 3, 5 years. So I would say, take one step at a time, be consistent, and just stay focused. So if, as long as you're able to do that, I think medicine is a fantastic career. But yes, you have to understand the commitment, and especially when it comes to parents, also the cost involved because of the regulation, the competition, and the number of seats involved. It is an expensive career to fund. So you have to also understand the budgets right up to post graduation. Lot of time people think about undergraduation as the only aim. The reality is, it's UG plus PG, because if there are, let's say, close to about 1 lakh, 18,000 seats for MBBS in India. At an undergrad level. For PG, their clinical seats are less than 30 to 40,000. At the same time, they are divided both into government and private. So obviously, it's going to be very competitive, and roughly 2.5 lakh students write the NEET PGs in India. So end of the day, it is going to be very competitive. And if you go for a private med school post graduation, those are expensive. So the financial planning is equally important for the next 10 years, because I always have been saying to students, and this is a real fact, that students who pursue medicine, whether UG or PG in a private med school in India or UG or PG abroad, financially usually they are independent, between the age of 30 to 32. So the parents need to be practically aware that they'll have to fund them until that age, and then obviously the students can take it forward. So
Thank you so much, Chirag. Thanks for sharing all your insights with us today. It was a pleasure having you with us on the podcast.